Bob Lindsay has Alzheimer's disease. A disease of the brain, it was formerly called senility or senile dementia. It used to be associated solely with aging, but Alzheimer's is not part of the normal aging process. It's a disease that destroys brain cells. Neurologist Dr. Donald McLaughlin describes the course of the disease.
There is, first of all, loss of memory, followed by changes in the ability to calculate and to use language, and intellectual function is affected. And then the memory for complex motor acts is lost, and eventually the disease progresses to the point where the individual loses virtually all control of their normal movements and body functions.
The disease usually leads to the patient being institutionalized, but doctors cannot predict the rate of deterioration. Bob's is very slow. Most common after 65, the disease can occur as young as 40. Heredity seems to play a significant role, but Alzheimer's can occur out of the blue. Vida Lindsay describes Bob's early symptoms.
I originally thought my husband wasn't paying attention to me, or else he wasn't hearing properly, either or, because he would come home from work and ask a question, you know, what did you do today? And I would tell him, and then he would, within 5 minutes, say instantly again the very same question, and I would give the very same answer, and this would often go on 3 and 4 times. And I would then, you tend to get annoyed and say, you're not paying attention, you're not listening, or I eventually took him to have his hearing tested.
There is no cure or clinical treatment for Alzheimer's, but because the progress of the disease cannot be predicted, it's important to optimize the quality of life while the patient is able to live at home.
Just get it on it again.
Part of the treatment is to set up an environment in which they have maximum dignity and maximum protection. One needs to, for instance, have an emergency number pasted beside the telephone. One needs smoke detectors in the house and to evaluate whether there are loose rugs, whether there are any poisons, whether there are accessible drugs that haven't been used, prescribed in the past and that are not in current use. Those should be thrown out.
Bob is doing better than many patients, but caring for anyone with Alzheimer's is a large responsibility.
It's a lot like looking after a child in a way. You have total responsibility. For women, it often means doing things that they haven't had to do before. All financial matters, all business matters, income tax, all the things that you have normally counted on your spouse to do fall to you to look after.
A patient with Alzheimer's disease can be extremely difficult to live with. In addition to demanding a great deal of supervision, they can also become aggressive or obstinate. These are common reactions to the disease.
Alzheimer's disease is associated with a change in personality. That's one of the major changes that occurs in this condition. And it tends to caricature the former personality traits of an individual. So if an individual was somewhat cantankerous or irritable before the disease struck, it makes the individual more cantankerous and more irritable. Now, that kind of cussedness, as it were, is a consequence of the disease, a consequence of the brain insult and how it's altered brain function. And the caregiver mustn't feel more sensitive towards that. They must try and roll with the punches, as it were, and ignore that irritability in order to allow living to go on.
On weekdays, Bob goes to a daycare center, giving Vida a much-needed break. For longer breaks, chronic care facilities will accept patients, usually for a minimum of 10 days.
Looking after a patient with Alzheimer's condition is extremely trying, and whenever possible, daycare is of benefit both to the patient and to the caregiver. It's a benefit to the patient because the daycare team have a great understanding of patients with this condition and meet a certain set of needs that a spouse or a caregiver is unlikely to be able to give. And they also give a sense of self-importance and worth to a person with this condition.
Local Alzheimer's societies can provide information about other services like Meals on Wheels, homemakers services, visiting nurses, and daily telephone checks. Vida feels daycare is very valuable.
They have a very good program of exercise, quite a bit of music involved, dancing, socializing. They have Christmas parties, birthday parties. Everything is an excuse for a party. And I think he quite enjoys it. It's stimulation. Any form of stimulation, I think, seems to be good.
Physical activity also helps with another common problem with the disease, insomnia, or an inversion in the sleep cycle. A first step with sleep problems is to limit the patient's intake of caffeine.
One really should try and institute an exercise program so that the individual is out during the daytime and is not allowed to sleep during the day. Then the third point is to stop fluid intake, probably at 6 o'clock at night, so that a full bladder doesn't wake them up in the night. And when all of those things have been instituted and still the caregiver can't get proper rest, then sometimes the nighttime sedative is useful.
Another common problem for families is patients wandering off and getting lost. The Lindsay's dog, Red, is a valuable asset.
Now, the dog's a real companion to a person, and there's surprise you, Vida mentioned it there, that she always knows where the dogs come in, and Red didn't go out, but he'll come know if I get lost. Red will come and find me. So that's a good thing to have right there, you know.
Not everyone has such a smart dog, and families should take other precautions.
You should have a recent photograph of the individual so that if the person became lost, you could give it to the police for identification. Secondly, the individual should carry in their wallet a telephone number and name and address of both their home and their next of kin, and that should be readily available within the wallet. I also recommend that one carry a medical alert bracelet with that same information on it, the name and the telephone number.
In some communities, police and the Alzheimer's Society have programs that register patients to find and identify them quickly. Another problem during the progression of Alzheimer's is that patients sometimes develop psychiatric disorders such as depression, anxiety, or hallucinations.
These are psychiatric changes which can be managed by the standard psychiatric medications. By and large, we try to avoid medications as much as possible because they all have side effects, and in the Alzheimer condition, the brain is even more sensitive than the young, healthy population to these major drugs, tranquilizer drugs. But on occasion, they are very useful, and they certainly will alleviate the severe agitation and anxiety.
Patients should also be watched for physical infections that can cause a rapid deterioration. Whatever the rate, caregivers should arrange institutional care several months before it is required, a difficult step to take.
And it often happens that individuals with Alzheimer's disease settle down in a controlled environment, such as a nursing home or chronic care hospital, and they settle down and actually have a better quality of life under that regimented routine that's part of a hospital day-to-day life.
Doctors do not know the cause and cannot predict the rate of progression of Alzheimer's disease. It's been 7 years since Bob was diagnosed. By living in a safe and secure environment and utilizing community services, patients can spend many years with dignity at home. The hope for the future is research.
But the bottom line is that at the present time we do not have a specific treatment for Alzheimer's disease. What we have to do is manage the symptoms, and we are very much searching for the cause of the disease, and will hopefully, with that knowledge, be able to develop medications that would be truly effective in treating the disease.